and welcome to Thrive by ArbeitNexus. Today, we are thrilled to have a very special guest joining us. Our guest is someone who's truly making waves in the healthcare industry. Please welcome Ms. Nita Viegas, General Manager, Human Capital Management at Sakra World Hospital, Bengaluru. Ms. Viegas has completed her Bachelor of Law from Mangalore University and Master of Social Work, Human Resources from Mangalore University, Mangalore. She comes with over 2 decades of rich and varied experience in the human resources. She has also worked with the who's who in the healthcare, namely Apollo Hospitals, Sci-Tech Hospitals, Mindspree, Bangalore, Sami Labs, Wockhardt Hospitals. She also has an entrepreneurial experience wherein she co-founded Striper Sports Academy LLP, Bangalore. She is married to Mr. Naveen Vegas and they have 2 children, Varun and Purvi. This is our first podcast session and we have a very distinguished guest today. Hence, we are like super excited. And along with Nita, who is, headlining this show, who's the guest of our show. Along with me, I also have Mr. Darshan Reddy, who is the CEO and the founder of ArbeitNexus. At ArbeitNexus, we are all about connecting businesses with the right kind of talent. And this podcast is part of our mission to share knowledge and empower the future of work. We are really excited to dive into our today's discussion. And the topic for today is enhancing patient care through smart talent acquisition and HR innovation. We are really excited to figure out how this entire session is going to pan out in terms of what insights we are going to get from our distinguished guest today. So before we start the session, I would hand this session over to Darshan so that he can take the session along with our distinguished guest today, along with his questions. And we really hope to uncover some deep insights about healthcare, about Nita, your experience as such, and how you specifically managed your career through especially in this emerging sector as such. Thank you so much to grace this occasion, and we are really honored to have you on board. Darshan, over to you. Thank you so much.
Okay, thank you, Rajan. Hi, Nita. I'm Darshan. I'm the founder and CEO of ArbeitNexus, and welcome to Thrive by Arbeit. You're the first speaker over here in the podcast.
Yeah, thank you so much.
As let's dive into the topic. As Rajan told that you have an enormous experience, 20 years of experience in the different industries across, so in this you have worked as an HR, as a founder. So you would have seen a lot of adoptions that this industry has gone through, a lot of changes that this has gone through across different industries. So what are the things that you think has changed, and what do you think tell us something about this industry that the people needs to know?
Yeah, Darshan, as you know that I've spanned through all the most of the verticals. Coming to the healthcare, the differences and the kind of nuances what we handle are a little different. See, because we have varied sections of people, the categories of people. We have the administration wing, we have the nursing wing, we have the doctors, the paramedics. So the nature of recruitments for these verticals is totally different. So with the nursing and paramedics, we have to we go to colleges and we meet the people. We try to sell our organization to these young minds. When it comes to doctors, it is totally a different thing, where we need to study them and get to know their outcomes and how good they are as a clinician and how good they are as individuals too matter for a healthcare domain. So now coming to all this thing, we have the new trends which are happening, and we as healthcare guys, we have to buck up and we need to adapt ourselves to the new technology. So now coming to AI, the artificial intelligence, what we do is we work with the small consultants who are actually developing some tools which help us. So what do these do? I mean, it is not that the recruiters don't need recruiters don't need to be there. It is not so. But only thing is, what is happening is with this AI, we are able to quicken the process. When a JD, you require a JD, we ask for the JD, and the bots give us the JDs. We match it with our requirements, and then the filtering process starts. So we do have your portals like Naukri and all this stuff, but then it happens like everything comes as a junk. Everybody wants to apply to every job which is available, so that kills a lot of our time. So this artificial intelligence and the generative AI which is coming in now, it is definitely helping us as recruiters.
Okay, okay, that's really informative and nice. Okay, so that's what even we see a lot of changes that's happening in this industry, and mainly in hospitality industry. We through Arbit we try to engage with the job seekers, and we help the employers get the perfect match, and we also shorten their time with the custom solution in all these areas. And moving on to the next one, in what ways does the right talent acquisition strategy impact patient care and overall health hospital performance, according to your view?
Yeah. See, all said and done, a hospital is not made up of walls and the equipments. The hospital is the people who are thriving hard to give their best for patient satisfaction. So the right kind of mindset is required. So I mean, how do we do it? So when we are recruiting, also we also look at the teams which these new recruits will go and sink into. So what happens is, when you say right kind of talent, I would say it is right kind of talent fitting into the right jigsaw spaces which are available for us.
Okay.
So for us, I mean, now I would talk with perspective of my organization. Like I work for Sakra World Hospital, Bangalore. And for us, our values, your respect, teamwork, passion, integrity, these are our core values of the organization. So we look out for people, and how do we do this assessment? I know your next question will be that, but then I thought I will just put it across to you. So what happens is, by and large, people are linked and networked in the healthcare domain. And when we want to recruit into their public domain profiles, we get into their profiles, we look at their practices, we look at their affiliations, we look at their interests. So the passion and the compassion is a bigger driver for us rather than the key skills only.
Okay.
So that is how we get. So you may think that we are spending time on Instagram or Facebook or a couple of these public domains, but yes, we do it with an intent to know our person better, to know whether this person has the passion to get into a healthcare domain.
Okay. Okay. What are the main streams that you're looking to when you want to hire? What are the different kind of ways that you look into?
See, when it comes to the doctors and doctors, nurses, and the paramedics, we have the streams are fixed for us. We don't have an option, right? So it is only the administrative staff when we are picking up. We have options. Maybe it is a BA, it is a BBA, it is a BCom. So these are the options which there. What we do is we look at BA plus what is more integrated in them. BA with sports, with social service, with NSS. Those qualities matter a lot for us, and those insights and those ingredients in the system matter a lot, because BA become that is only a platform for somebody to take off. So beyond that, these are the things which make what kind of friends you have, what kind of NGOs you work for, what kind of groups you're affiliated with. So this is how we make our choices.
Okay. So it's not the academics that you choose. It is one of the factor, but it's all what they do, the extra thing related to the work is what that
Yes,
matters. That's
yes,
very
yes.
clear in this.
Yeah,
That's
yeah. See, academics can get you to the door, but
yes.
bringing you in is the other things which you have done in life, and how different you are, how agile you are, how easily you flip your roles, and how diversify your mind is what matters. And for that matter, we have people who are a little hesitant when they take breaks. Especially the women folk, they take breaks but they are very scared to say that I did take a break. I did take a maternity break. I did take a family break. But I tell guys, you need to be very happy about it, because what we would infer from that is the guy or the girl knows to have priorities in life. And they have taken a decision by keeping their family as the core. So we admire such people and will definitely be happy to take them back.
Okay.
So that means their mind is very, very clear what they want to do at the right time.
Okay. Okay. That's nice. That's nice. As per this thing, I understood one thing that, the things what you told now, that is what differentiates from another person to get hired over there quicker.
Yeah, of course. Yes.
How does HR contribute to creating a patient-centered culture, according to you?
Yeah. See, what happens is when when the patients come to us, there is so much of competition across in the market, and there are good doctors everywhere.
Yeah.
So, but when the patient comes to us, we need to analyze as to why these patients are coming to us. Why are we becoming the hospital of choice? So that is because the kind of service, the kind of passion our team has towards the patient. So what we ensure is, at the beginning, we ensure that we take care of the recruitments and the kind of mindsets the people come in with. And then what we do is we incubate them. We incubate them and we condition them to the expectations and to our values. As I said about our values, respect, integrity, passion, teamwork. I think that will knit a person perfectly into the system, which gives a patient delight rather than patient satisfaction. So a lot of training, conditioning, reasoning as to, and every time when we do our training sessions, we tell the people, don't do something which you don't like to be treated like. So this is how we take care. And once we have these incubated sessions for them, that goes for about 45 days, where we don't give them patient allocations and all that. After that, we see the readiness of the person, and again it is a subjective allocation of work. See, a may be very good and ever ready to take up full-fledged work. That person will get a full-fledged responsibility. So it diminishes with the abilities. If the ability diminishes, we give the, so that the person does not get what frustrated, like the person does not feel that I have failed. We don't let the person feel that he or she has failed. So that is how we work around, and we work very closely with the team leaders, who give us the inputs and ingredients. So that's how we ensure we get the patient centric what is that, deliverables from our team members.
Okay, that's nice. That's nice. I want to see when we talk about you. You told me that for the doctors, paramedics, everything is said. When it comes to administration, how do you retain the talent actually?
Yeah, it is quite tough, Darshan, retaining the talent, especially in the administrative, because what happened, the world is wide for this particular category. So in these cases, what we do is we have special programs. Of course, these programs are there for all the categories, but there are special programs like something called Spark. We have that initiative at Sakra World Hospital, where we say skill, personality, your attitude, resilience, and knowledge. So this is the acronym for Spark. So what we do is we select a few people, enable them to get into this certification. And there what we do is we teach them financial literacy as to how your mutual funds, your shares, how you can do, how you can invest and where you can invest. We give them digital literacy. It is a 3 months course. So we give them digital literacy and help them, to unleash their knowledge for the new technology. And then what we do is we also enroll them into some special trainings, so which are OJTs. So these OJTs, the on job trainings. So what we do is we make them feel that they have a future, and we not only make them feel, we are sure they have a future in healthcare, because healthcare is one domain we have seen during COVID that we are going to stay and we are robust. So that is the feel and the attraction what we build in them to stay back with us. It is difficult though. I know people do tell them, okay, why you, after doing this, why do you want to work for a hospital? So we need to work more with this population.
Yeah. So, whatever happens, an hospital is going to work anytime. To the viewers, I would always say that, hospitality and hospital is one place which will never have a recession kind of thing. It is always open, and always there are jobs. And I wanted to, Nita, will you keep any backup for these kind of things, for administration in these areas?
Yeah, Darshan, what we do is backup in the sense we have a program called this one, the Blooming Buds.
Okay.
So just to tell you something about this Blooming Buds, what we do is we work with colleges. We work with colleges, and the colleges who want to send their children for students for internships, we give them a free internship here.
Okay.
So we put them in, we allocate them to the finance, we allocate them to purchase, HR, marketing. So what happens? They are knowingly, unknowingly, they get the vibes of the place. They get to know as interns for 2 months, 3 months, 6 months, they will be here with us. And then what happens? They are our backup.
Okay.
So by and large, these interns who come here, who experience us, and who feel the culture of the place, they choose us as their this thing of employer. I mean, choice of employer. So this is the backup for us. We never keep people on bench as IT industry. We don't believe in doing that because somehow idle mind is a devil workshop. So we don't believe in that concept of keeping people on the bench.
Okay. So you told me that you worked in several industries, like various industries, right? Let it be IT, let it be anything. You told that hospital is one place where I will not move from here.
Yes.
So what is the reason for it?
Yeah. See, I somehow believe as an HR in an industry like your pharmaceuticals, which I worked, electronics or IT or textiles, I was only able to contribute to my people, I mean, to my organization, to the team of people which I work for. Whereas in a healthcare domain, as HRs, we can actually impact the society. We can help people to get in touch with the right doctor at the right time, enable the best treatment. Because the moment we are confident about my workforce, I will never hesitate to refer my hospital to another person who is known to me. So as HRs, we are able to bridge that gap between the doubts which are created. The lot of doubts about good doctors, good places, good hospitals, and all that. So we are able to contribute to that level that we become the business partners of the place. So when I say business, I don't mean the literal sense of business. When I say business is I'm able to the demand, the need, and the availability. We bring them together as HR guys. So that is why I feel I don't think I will look out for any other domain. Having worked in healthcare,
That's
because it gives that immense joy and satisfaction for me, especially. I mean, healthcare. I think I like it.
okay. Okay. No, last second question. There are two questions which I really want to ask you. Do you think that HRs in hospitals are not recognized or underrated for the success of the hospital?
I absolutely don't agree with this statement. Let me just tell you why. Because I worked in other hospitals too. Where HR's role was limited to the level of residents who are just MD guys. Whereas in a hospital like Sakra, HR's role is not limited to anything. So when we come to recruitment, that the top-notch consultant of the industry is recruited by the HR person. So what you say, the value, and sometimes what happens, the tag HR doesn't give you the value. It is, we need to learn, inculcate other, because talking to doctors for 1.5 hour and getting them incited about our organization is not
Yeah.
an easy thing. So that way we need to create that brand for ourselves. And if we create that brand, I think the market is ready to embrace us as performers.
Yes.
So I don't think there is a dearth for recognition at all.
Yes.
I mean, especially this talk of mine is with reference to my current organization.
Okay. 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 That's
Yeah.
that's good. Every success in a hospital, every place that an HR fills, it is very important that an HR will go through each and every step to get the person in, because it is very important and vital for the HR to look into each and every detail. I think there you people do a very wonderful job, very wonderful job. And the last question for this podcast, Nita, what future trends do you foresee in healthcare talent acquisition, and how should HR departments prepare for them?
See, currently what is happening is, yeah, there is a dearth of skilled manpower, or, there is the dearth of good talent. So what's happening is that gig economy kind of themes are coming in presses. There are a lot of, I don't know if you've heard, because you are more into hospitality industry. Here, the locums, people come work for the day. So, but what kind of jobs we outsource? We don't outsource all the jobs. Somewhere where it is not very niche, those kind of things, that kind of a mentality has come in. And what's the next, what kind of interventions we need to do is, we can't wait for person to come to us. We as HR guys of healthcare domain, I always see, HR healthcare does not get the cream of the institutes. Is what was the saying. The good IT guy gets into the IT domain. A good finance guy gets into the finance domain. It is as long as we HR guys of the healthcare domain don't take the guts and grit to tap these resources, whom we otherwise think, are not going to, the cream is not for healthcare. We assume those things. So this thought process has to change for the healthcare HRs. And once that thought process change, we will put our hands into the cream and not wait for the milk to come and approach us. So inciting the candidates to join us rather than taking the candidates who come and knock our doors, that is what we need to do. And another thing, there are a lot of interventions. I've been working with a independent person, a consultant, technical guy who has HX. He's doing something for us, so we have named him as HX Sakra, where he's building small apps for us to look at how AI gets integrated, or co-pilots for a HR person. So those kind of interventions, we have to look at. And we as HR guys should never think that it may not be possible. Everything is possible.
Yes.
So one thing is for sure, AI will never replace us, but we without AI are replaceable. So HR guys, without AI, we are replaceable, because there is somebody who is going to come, who will integrate AI in them, and he will get just. And there is a saying that people are getting rusted, brains are getting rusted with this chat GPT, Claude AI, and all this stuff. Brains are not getting rusted, but what we need to understand is, we have to feed the machine as to what we want. The sentiment has to be given by us. So we still need to think. So running with the pace and adapting to the new technology is something what we need to do.
Okay, okay. Yeah, it was really very informative. As you said, AI is going to simplify your work but never replace your work, because it is very important for a institution to have an HR to look into different parts, to look into different areas in the hospital, in the different various industries. I think AI is going to simplify that work.
We can
And
only be our co-pilot. It's
yeah,
we who
yeah,
are the
definitely,
pilots.
definitely. Yeah. So
Yeah.
it was a very beautiful session, very informative session. Thank you so much for joining with us, Nita. Thank you so much. You have really spoken very good and given a lot of information to the people who are going to watch this.
Thank you so
Thank
much,
you.
Darshan. Thank you, Rajan, for connecting with me, and thank you so much.
Thank you, Nita. Thank you.
Thanks.
I'll just quickly wind up. And Nita, what I really liked about this session was, like, how you passionately spoke about the sparks, and how you passionately spoke about, the blooming buds as such. And also how you passionately spoke about how you are managing your talent for the admin department as such. That's sort of a category of people who are working with you all. It's of course we have heard from many other organizations and everything, but every organization has a way of looking at that particular thing and approaching it in a very creative and in a very subjective manner. What really works for them and what really works in the realm of what the company stands for, their DNA, and what the culture it is and what they're trying to build. It's really great, and it's really amazing to see these kind of initiatives being run by a leader such as for a big organization like Sakra World Hospital, for example. At the same time, you also spoke about how maintaining a work-life balance is really critical for you, and you are open-heartedly welcoming people who have taken a break and trying to understand what was the reason why they took a break, and why and how and what they want to make an impact towards coming back to the industry and contributing to a bigger role and everything. I mean, these are the things we really, as professionals, we really want to hear stories and want to understand how these things are applied in organizations and companies as such. Thank you so much. And with that, we really come to an end of a very engaging session with Ms. Nita from Sakra World Hospital. And Darshan, thank you so much for managing the show really well. We had a great time talking to you, Nita, and learning and understanding so many things in the session today. We are going to be back with yet another industry leader with yet another amazing topic. So stay tuned, guys. Please visit our website. Please visit our Spotify channel, our YouTube channel, which is ArbeitNexus. And here's us signing off from ArbeitNexus. Thank you, ladies and gentlemen, and have a very good day. And thank you so much, Nita. It was wonderful talking to you. Thank you.
Thank
Darshan.
you so much. I appreciate it. Thank you, Darshan. Thanks and goodbye. Thank you.
Thank you. Bye. Bye.